The purpose of this video is to give you a general idea of what to expect if you are referred for a colonoscopy. The procedures described in this program may vary from one clinic to another. The details of how you should prepare your intestines for the colonoscopy may also be different from what your doctor told you to do. Always follow your doctor's instructions. Your doctor may have referred you to a gastroenterologist for a procedure called a colonoscopy, which allows a tiny camera to look inside your colon.
Colonoscopy is a test where the gastroenterologist or the endoscopist will take a tube. It's a small tube, about the size of a small finger, if you will, but quite long enough to see the entire colon. It's introduced through the anus and moves up the colon through various maneuvers while the patient is given medication so that we can see the lining of the colon. We try and see if there are any abnormalities or not, and if present, we can both take samples and we can treat whatever abnormality we might see. We would go ahead and do a colonoscopy, therefore, for patients who present with symptoms and signs to evaluate them, to diagnose and to treat, obviously. We would also do it for screening purposes, so-called average risk patients between ages 50 and 75 who would not have a family history of colonic polyps or colon cancer or personal history of those would be a candidate. In addition, people who do have a history of colonic polyps or colon cancer, either themselves or a relative, would be so-called higher risk for screening colonoscopy.
You may also be referred for a colonoscopy if you have previously had a positive chemical testing of stools for blood, a barium enema, or virtual colography that showed you might have a polyp.
And finally, we would do colonoscopies for surveillance, particularly patients who have conditions that increase the potential development of other entities, such as colon cancer, as would be the case for patients who have inflammatory bowel disease affecting the colon. Some of the benefits of having a colonoscopy include, obviously, its relationship to colon cancer and what it can do for patients in whom that is a concern, or that might be a concern. With the colonoscope, we can go ahead and detect polyps, and we can remove them and analyze them. That treats the polyp if it's benign, as is most often the case. If it is malignant, or if there is cancer within the polyp, we can detect it early on and sometimes cure it through endoscopy. In addition, colonoscopy can provide treatment for patients who would present with bleeding per rectum, as well as in the context of surveillance. It allows us for early diagnosis and potential therapy of patients who are at risk for developing cancer, such as patients with inflammatory colitis, as well as patients who've had previous colon cancer.
Before my first colonoscopy, I was very nervous. I had no idea what the procedure was like, and when I went to the hospital, the first thing that calmed me down was the medical staff. They were completely reassuring, very expectant of the anxiety levels of people coming in, and kind of put that to rest immediately. So once I had my first one, it was like I'm staying on top of it, and that was just so reassuring that I never worry about going, and I kind of count off the time before I'm going to go for my next one.
How you prepare for the colonoscopy may vary from one clinic to another. Always be sure to follow your doctor's instructions.
To prepare for the procedure, you have to go to the pharmacy to begin with to buy the product that will help you clean out your intestine.
There are a number of different products you can buy at the pharmacy to clean out your bowels before your colonoscopy. Go Lightly, Pico-Salax, and Fleet Phosphosoda are 3 common examples. If you have certain conditions like heart disease, kidney disease, a possible bowel obstruction, or advanced liver disease, be sure to talk to your doctor about which preparation is best for you.
You have to mix the product with some water or a clear juice. Then you have to drink it all. It's very important that you drink it completely, and drink a lot of clear fluids also, like apple juice, ginger ale, water, jello, broth. Any fluid that you can see through would be considered clear fluid, so that you're well prepared for your exam the next day. We do tell them not to have red jello, for instance, or red popsicles, or purple because it does stain the lining a little bit inside, the fluid that's left behind, because the colon is almost impossible to clean completely. There's always some kind of juice that's left behind. After the patient has mixed their product with water, and after they've taken it and finished it, they will expect cramping, bloating, to be in the bathroom for a few hours, and they should not make any plans for the rest of the evening.
Depending on your doctor's instructions, you may have clear fluids up until a few hours before your colonoscopy.
So when you're going to be scheduled for a colonoscopy, it's important to mention to the secretary, the nurse, or the physician, whoever is arranging it for you initially, about any type of condition that you might have, such as diabetes, heart failure, kidney disease, and so on. These relate both to the preparation and to the timing of the procedure on the day of the procedure. As well, you need to mention what medications you're taking. Particularly caution needs to be taken with regards to blood thinners, such as Coumadin, as well as other medications that can affect bleeding, such as aspirin or anti-inflammatory medications. In addition, you need to mention any possible allergies that you would have to any medications. And finally, also very important is that you need to make sure that someone will come with you and will bring you home after the procedure. Let it be a relative or a friend.
On the day of your colonoscopy, the patient will come and register with the secretary, where she will afterwards ask you to sit in the waiting room, and then a nurse will come to pick up the patient to bring them to an assessment room where she will ask them various questions about their medical history, the medication that they might be on, try to relax them a little bit, answer their questions if they have any, and then they will be asked to change into a hospital gown and taken to another area where they will wait for the procedure room to be ready. When the patient is brought into the procedure room, they are asked to have a seat on the stretcher where we put in nasal prongs to give them a little bit of oxygen during the procedure, and a blood pressure cuff to be able to take blood pressure during the procedure or afterwards as well. We also put a clip on their finger to measure their oxygen level. The IV is started in the patient's arm so that they can receive some medication to relax them during their colonoscopy and make them more comfortable.
So just before going ahead with the procedure, the physician will inquire again about any medications that you're taking, as well as any allergies to medications and any medical condition that you may be suffering from. Prior to securing consent from you, the physician will explain the risks to you. They're very small, particularly in the context of colon cancer screening, of the order of 1 in 5,000 or so. They include a risk of bleeding, as well as a risk of perforation. The risk is slightly increased if polypectomy is required, meaning if we remove a polyp at the time of the colonoscopy. But again, weighing the risks and the benefits, that risk is very small.
In addition to explaining the risks and benefits of the colonoscopy, the gastroenterologist will also explain the alternative tests that might be available to you.
So at the time of the actual colonoscopy, the physician will ask you to turn onto your left side, and they'll give you some medication by the vein. You may feel dizzy, you may fall asleep, you may not. It varies tremendously from person to person. You may or may not be able to watch on the screen as the physician does the endoscopy. As the colonoscope is inserted through the anus, you may feel a little bit of bloating or some discomfort because we need to put air as we do the test. If not, we can't see anything. That may also lead to some cramping as the test is done. Please make sure to tell the physician and the nurse if you're uncomfortable at any time, because we do have the technology to keep you comfortable as we do the procedure.
Also, you may ask them to change position, which would mean asking them to go from their left side to their back and sometimes to their right side, and very rarely on their tummy, but they may expect to be asked to change their position so that they can make the exam a little easier.
They may remove a polyp if a polyp is seen. They may do biopsies or just have a look in and then come out, depending again on what is found at the time of the procedure. The procedure in its entirety should usually last between 15 to 20 minutes. Following the colonoscopy, you'll be expected to recover in a recovery area, which can last approximately up to an hour or so. After that, you'll be expected to go home, but not to drive for the next 24 hours. That's why we ask you to go with a family, relative, or a friend.
What happens after your colonoscopy will vary according to the clinic and to your specific case.
After the colonoscopy, you may feel bloated still if you haven't passed the air that we have put in there during the exam. You might feel crampy because you haven't passed the air. But once you've gone to the bathroom and expelled or let most of that air out, you'll feel very comfortable. You won't feel sore, or most patients don't complain of soreness and they can go home. You shouldn't have any after effects of the cleansing after the exam. You can eat and drink as soon as you leave.
If you do experience a lot of pain after your colonoscopy, be sure to tell your doctor right away.
If we've removed the polyp, you may experience a little bit of spotting with blood as well, just from the procedure itself. It's possible, although significant bleeding would be abnormal and you would need to come back for that. The follow-up will be arranged with your family physician or your specialist or the endoscopist, depending on what is done locally. In summary, at the end of the day, colonoscopy does a lot of good things for patients. It allows us to follow up on symptoms that patients have developed. It allows us to make a diagnosis, and in many cases, to provide definitive therapy. In the context of screening or surveillance, it allows us to take people who are at average risk or people who are at increased risk, particularly for colon cancer, and allow a very effective way of finding problems early on.